Hospital Infantil de las Californias was inaugurated in 1994 to offer health services to children. The hospital was born thanks to support from business, government, and the community. On its walls, in its corridors, and in the faces of its people, we can see the daily sense of satisfaction that comes from improving the health and nutrition of the boys and girls of our region. Let's get to know it. Let's take a look at a day in the life of Hospital Infantil de las Californias. Our waiting room. Here, we find parents and their children visiting the hospital for the first time, as well as those who have already benefited from the hospital's services. Our reception area. The patients are served by friendly personnel who explain the services we offer. The visit of a patient lasts on the average an hour, from arrival at the hospital, then being weighed and measured, and seen by one of our health professionals. Our consultation rooms. It is noteworthy that our consulting rooms are decorated in child-appropriate themes that provide a pleasing and comfortable environment. Each room is sponsored by a company that generously provides the proper equipment and creates a friendly atmosphere. This is where patients are examined by one of our more than 80 health professionals. Each first-time patient at the hospital will visit a pediatrician who will determine whether the patient should be referred to another of our 30 specialists. Our management office. Here, we coordinate all work relating to consultations, including the scheduling of our health professionals and patient services. Our Department of Social Work. It serves those patients who require financial support in meeting the cost of consultations, surgery, medicines, x-rays, and laboratory services. Our Rehabilitation and Physical Therapy Clinic and Center for Referrals and Special Education. Here, we help patients who have problems such as psychomotor development, cerebral palsy, and muscular dystrophy. Physical therapy is prescribed by a doctor specializing in rehabilitation and administered by a physical therapist who explains the techniques to the parents so they can be done at home. The clinic also has a hydrotherapy pool. As an added benefit for our patients with special needs, we offer our Center for Referrals and Special Education. The center provides orientation and information and organizes parent support groups. It also coordinates drives for donations of wheelchairs and offers referrals for services outside the hospital. The pharmacy provides medicines for children and adults to both the hospital's patients and the general public, and is staffed by students from the University of Baja California who are fulfilling their social service commitments. Our surgery. Currently, our hospital performs an average of 40 surgical operations monthly. The most frequent are tonsillectomy and adenoidectomy, strabismus, bilateral inguinal hernia, bilateral orchidopexy, and palatoplasty, among others. Our fees. Our fees are on a sliding scale and offer all of our patients a savings of more than 40% in comparison with fees for private services. Our duty to educate. One of the principal objectives of the hospital is to educate patients and their families, focusing on disease prevention as well as an ongoing nutrition program. Our work beyond the hospital. Hospital Infantil de las Californias provides service beyond its walls by means of a community clinic in the city of Rosarito, a community clinic in the community of Nido de las Águilas, and an office providing pediatric consultations and referrals in the city of Ensenada. Our patients. They are children of all ages, from newborn to 17 years of age, and they are from all socioeconomic levels. They are children who come for a well-child visit with their pediatrician and children who need a specialist or surgery. They are children who have spent one day or more in the life of Hospital Infantil de las Californias.